Hey, Dr. Max here. Our patient today is 26 years old male with Norwood 4 degree of the hair loss. We plan today 2800 grafts to address the frontal and the crown area thinning. Okay, our patient today has a frontal thinning and some crown thinning. So crown thinning is a partial hair loss, so I'm going to just reinforce it here, and we'll reshape his hairline. As you can see here, this is the hairline design. This is the transitional area right here, followed by, of course, the high density zone and the mid-scalp. So total is calculated to be approximately 3,500 grafts. It suggests 37, but I think we can make it with 35 because we don't have to be too aggressive in the crown area here. Okay, so what about the donor area availability? So we are in really good shape here. So if we are to harvest half of what we need, we still have available 3,300 grafts. So it's quite a impressive donor area here. His average diameter of hair shaft is 66, which is quite good. And let's see what the render looks like. Here we go. This is roughly the density that we expect after the procedure. What is important when we consider hair restoration in the partial hair loss? It's not a 100% standard treatment because the pre-existing hair can continue to miniaturize or undergoing androgenic alopecia-related changes over time. So it's very important to emphasize to anyone who is considering hair restoration in partially hair loss area is to start on preventative therapy. It's absolutely 100% essential, and we're on the same page with our patient today that he was initiated on topical finasteride and minoxidil solution. Does have good results. So at this stage, I'm done with approximately 2,500 grafts. I harvested from right temporal and occipital areas, and now I'm working on the left temporal area. Let's talk about hairline a little bit. In order to make hairline look natural, and the goal is always for my patients to look like nothing happened. If me as a hair transplant surgeon meet my patient on the street sometime, that I won't be able to recognize that he or she had a hair transplant. So it's a little tricky because I need to find those fine hair follicles, identify them specifically, put them aside, and use them to create the transition zone. And you can see on the image where transition zone is. The presence of the transition zone is absolutely detrimental for the natural looking hairline, and that's exactly what we're going to be doing today. So far we got approximately 250 fine hair grafts, and I'll be placing them randomly with preserving macro and micro irregularities. So stay tuned. Next stage after I'm done harvesting another 300 grafts would be the implantation phase.